history with the flu and just some additional tips and tricks since we're getting into flu season, aka vitamin D deficiency season. And if anybody had the flu, do you feel like you had the flu? Never had the flu?
I did.
Yeah.
A few times.
A few times?
Not good.
Yeah, no fun, right? No fun. It's probably been a decade or more since I've had the flu. So first off, I want to thank you guys for being here, learning some information that you can take home and utilize. You only spend a couple minutes with getting your adjustment, which again gets processed by the body for 24 to 48 hours. But we want to make sure that we're also teaching you additional ways to help prevent subluxations, which is why these classes are so important, because they really help to add to your care. And so we know that it took something to be here right now, and so we really appreciate you guys doing that and being here. So, obviously, we need to stay home and take care of ourselves if we have the flu, right? I think that's one of the biggest things that we can take away from this experience is to quarantine. And that should have been what we've been doing all along, but unfortunately we push ourselves. When we get sick, we go out still. We go to whatever engagement we are committed to instead of sitting at home and taking care of ourselves and allowing our body to heal. Obviously, avoid contact with people. Wash your hands frequently. Drink plenty of fluid, especially water, and supplement with vitamin D and C, magnesium, and zinc, and get adequate rest. So what's interesting is there's been multiple resources that I've been following. Let us know if you need any help.
No, I'm good.
You're good? Okay, great. There's been multiple resources that have been talking about the benefits of vitamin D since the very beginning of this pandemic, and showing that the death rates in vitamin D deficiency is close to 84% in Louisiana, 98% in the Philippines. So there's been a direct correlation, which doesn't mean there's causation, but there's been a direct correlation with people who are not succeeding in fighting this infection are vitamin D deficient. And now, 7 months later, the mainstream media is finally saying, you should probably take vitamin D, which that's probably I wish they started from the very beginning, talking about drinking fluids and taking extra vitamins and teaching us how to properly care for our immune systems. So those are some things right off the bat, just throughout the year. And you can get a great magnesium zinc supplement on Amazon. You can get vitamin D and vitamin C at Walgreens and on Amazon. And you know, even just 1,000 to 5,000 vitamin D IUs a day is really beneficial. That's a lot of nutritionists and dietitians that I follow recommend that as a maintenance preventative dosage for your immune system. Also, eating a wholesome diet rich in vitamins and minerals. Fish is very high in really good vitamins A, K, and spending a few minutes a day in the sunlight. But that's also, we're getting more inside. It's not that the flu is not around the other weeks out of the year. It's just we're in more enclosed spaces and we're seeing less sunlight. So we start to see a spike in cases because we're more together. You know what I mean? So we're not out in the open or outside breathing fresh air, and so that causes things to fester and create a level of the amount of virus within your body that causes an immunological response. So we we're going to talk about how chiropractic adjustments help with that, homeopathic remedies, exercise regularly, and lower stress through meditation and other healthy lifestyle changes. So let's just take a deep breath and hold. Breathe in a little bit more. And slowly exhale. So doing that, even just 3 big deep breaths at the stoplight, when you wake up in the morning, at night before you go to bed, can help to decrease those cortisol stress hormone levels that create inflammation in the body and cause an immune response. And so if we can decrease those cortisol levels, then we can allow our stress level to be less hyperreactive and support our immune system that way. Here's a little bit of a smoothie recipe if you guys are into smoothies. Really, it's just packed full of vitamin C. Frozen mango would be sufficient as well. Ginger is really great. Chia seeds have some great vitamins and fatty acids. Spinach. I usually add almond milk rather than water. And then a hot lemon cold remedy. Adding ginger, onion, turmeric, cinnamon, clove, and garlic. And so you want to boil all of that together for 15 minutes. And then you dilute it. So you add some cold water. You can make a huge batch of it and keep it in your fridge. And then add it to some water and drink that. Also can help stimulate some antiviral, antibacterial properties with the ginger and the onion and cinnamon, clove, and garlic. Do any of you guys take something like this or utilize like a tea during cold and flu season?
Yeah, I've just never heard of this method. That's actually really cool.
Yeah. Yeah, big pot, and simmer, add hot water, honey and lemon to taste, and apple cider vinegar is really good as well. Okay, so how do spinal adjustments positively affect immune function? So it's showing how the immune and hormone systems are all in development and related to illness. So we're seeing the common denominator, the immune system, the hormone system, they're all related to how we react, how our illnesses manifest in our body. And if we're having a high stress, low immune system function in our bodies, then we're going to have a lot of colds, a lot of symptomatic experiences. Because again, we are encountering thousands of viruses and bacteria every single day. They're good. We need them. We need them, the little microbes in our body, our microbiome. And if we get too much load, if our body isn't able to balance that out because we're not properly taking care of our body, and so the bacteria and the virus increase, then we start to have symptoms because our body is again trying to purge the virus. A fever is a really good thing. It burns the virus off or burns the bacteria off. So we want to experience that fever. We want to monitor it closely, but we shouldn't be rushing to the emergency room right away. We should know certain things like skin-to-skin contact with babies helps to bring homeostasis with their temperature. And even having a lukewarm bath helps to balance out a fever and bring a temperature down if it's too high. But a 101, 102 fever, that is a good temperature to burn the bacteria and the viruses off. So again, chiropractic care corrects those subluxations, and since the nervous system controls all the function of the body, including the immune system, it has a direct effect on the immune system. So according to some research that Dr. Christopher Kent came across, it's showing how managing patients with viral and infectious disease. So I think we're going to look at an AIDS virus in a moment. But basically it's showing understanding the brain, understanding the immune system, how they're both adaptive parts of the body. So our brain interprets our environment. And the way that your brain interprets your environment, we're seeing how the spine is in alignment allows the brain to properly understand where your body is in space because of the cerebellum. Are we all familiar with the cerebellum at all? So the cerebellum, when you get dizzy or intoxicated, it directly impacts your cerebellum because that's where your balance is and your movement. And so your brain is aware of where it is in space in direct correlation with how your spine is in proper alignment. So if your spine is out of proper alignment, then it's not sending the proper signals of where you are in space. So that can lead to increased falls, which can lead one of the biggest causes of death in the elderly, or leading that, is falling, are accidents. That's why we have all of the emergency button commercials happening. So by knowing where your body is in space can decrease those falls, along with understanding and interpreting your environment can lead to either increase in stress or decrease in stress. So if you're able to interpret your environment properly and more effectively, then you can respond appropriately. Maybe you don't respond like you're being attacked and stressed out. Maybe you respond in a more relaxed way. Any questions? So the brain and the immune system talk to each other, and this process is essential for maintaining homeostasis and balance in the body. So some fun facts about the flu epidemic in the 1900s. So it was estimated 20 million people died around the world, including 500,000 Americans. And this actually led to us finally getting licensure in states. So a lot of times we talk a lot about chiropractic history in the office. So have you guys heard about one of the trivia questions during Chiropractic's birthday week, which was 2 weeks ago, was how many times the chiropractor went to jail? Do you guys remember that question at all? No? So we went to jail because we didn't have a license. And so they were telling the chiropractors that we were practicing medicine without a license. And the chiropractors were like, no, we're practicing chiropractic. Please give us a license. You know, you can see where this is going. So actually helping with the flu victims led to many states finally giving us license to practice chiropractic. We had to create our own license, essentially. And that is because out of 93,000 patients treated by medical doctors, there were 6,000 deaths. You guys can see how I'm rounding. A loss of 1 out of 15. When we looked at the chiropractic school, Palmer School, the chiropractors adjusted and cared for 1,635 cases with only 1 death. And outside of Davenport, which is where the school was, the chiropractors in Iowa cared for 4,735 with only 6 deaths. So that's 1 out of 866. Now, unfortunately, our research in the 1900s was not as on point as it should have been, or like it is now. So we just can see a correlation here, right? But now that we're starting to be able to measure things in the brain and measure how the immune response occurs after an adjustment, we see an increase in white blood cells, we see the brain resetting, and we see a decrease in the stress response. Then again, we can connect this and see, okay, the body, these patients were able to fight the virus more effectively because their nervous system was functioning efficiently. Does that make sense? Any questions? Okay. So in Oklahoma, out of 3,490 flu patients, there were only 7 deaths. And again, they were called, chiropractors were called in 233 cases given up as lost after medical treatment and reportedly saved all but 25. So this is from the official history of chiropractic in Texas, chiropractic statistics, and the chiropractic research and review. So that's really interesting. I mean, they're like, we get so many people in here that are like, oh, well, I've done this, I've done this, I've done this. I don't know. I guess we'll try this. And then it works. It helps. because we're not treating any symptom, we're not treating any illness, we're not treating any disease, but we're resetting the body, we're resetting the immune system, we're resetting the nervous system, and allowing that healing to happen as effectively as possible. So they're not surprising because we can see these immunoglobulins, white blood cells, pulmonary function, and other immune system processes are directly related to the nervous system. So this is a pretty interesting study. Let me zoom in here. So we found that when an adjustment was applied to the thoracic spine, the middle back, the response of white blood cells taken from blood collected 15 minutes after the adjustment was higher than the blood collected 15 minutes before the adjustment and 30 and 45 minutes after the procedure. So 15 minutes, 30 minutes, and 45 minutes, there was a higher white blood cell count than the blood collected 15 minutes before the adjustment. So we're seeing that the adjustment actually triggers an immune response. Another study of HIV positive patients conducted, and this was with a specific adjustment to the upper cervical spine. So there's over 300 techniques in chiropractic. Did you guys know that? Yeah. You can throw a stone and have a totally different experience. So this is focusing just on the upper cervical spine, and over the 6-month period, the group that did not receive chiropractic care experienced, let's say, an 8% decrease in CD4 cell counts. So those are the immune cell response. The group that received chiropractic adjustments experienced a 48% increase in CD4 cell counts over the same period. So how amazing is that? You know, I mean, that's just like looking at a 6-month period, we're seeing a decrease in immune cells because of the HIV virus. But with the adjustments, we're seeing an increase in this response. So going back to those lost causes of people with flu back in the early 1900s, and all but 25, so 208 people survived who were lost causes. These are the type of things that, like, Dr. Krista and I, why we're so passionate about talking about chiropractic being a #1 resource. It should be the first line of defense. It needs to be the least invasive option. And unfortunately, we're still fighting the stigma of, you know, that chiropractors have. And we are increasing the percentage of people under chiropractic care, which is fantastic. But so many people need this so that they can not be sick, so then they can take care of their family, they can go to work, they don't have to worry about, they can use their sick days to be on vacation rather than being sick at home, right? Okay, so here's one last study. A large study of 3,000 people talked about having physical symptoms, stiffness, lack of flexibility, physical pain, fatigue, colds, flu, headaches, and the incident of colds and flu were reduced by an average of 15% in this large population who were undergoing regular chiropractic care. We've also talked about how the Tennessee Blue Cross Blue Shield insurance company actually was able to measure that people who were under chiropractic care had a 56% less medications used, 48% less hospital visits. So, I mean, this is an insurance company. They're able to take all of that data and look at, okay, these people were using chiropractic care, these people weren't, and we see how these people use less medication. So they're saving us money. So we can see how they had a reduction in colds and flu when they were under regular chiropractic care because, oopsie, we have an increase in CD4 cell counts, an increase in white blood cell So we have an increase in immune response. So we are able to fight the bacteria or balance out the bacteria that we come in contact with. Because again, we are constantly coming in contact with bacteria and viruses. They are our friends. And we need to make sure that we can keep it balanced, right? So we want to get rest, take our vitamins, exercise, drink at least half of your body weight in ounces in water, hydrate, 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 and get adjusted. We are talking about the 14-day rule for your friends and family to get adjusted, for parents of little ones who are under care to get an exam, not an adjustment, but a complimentary exam. So we're constantly asking, who can we help, or what zip code can we find somebody in to find a resource so that their spine can at least get checked to see if they can get the benefits of chiropractic care. Because we know that our society will be so much more efficient and relaxed and be able to think clearer and have a stronger immune system when they're under regular chiropractic care. So we unashamedly constantly ask for referrals or zip codes to find out who we can refer your friends and family to. Okay. Let's see here. Perfect. 20 minutes. Just like that. Nice and easy. So, I hope you guys took something away. One little nugget of information. That's all I'm looking for. And, Tammy, can you hand me a Post-it note, please? Or a Post-it note. A double pen. I got a pen. Okay. So, please take a Post-it note and a pen. I'll do that. You guys can share. You got a pen? Okay.
Should I end it?
Yeah. Bye, everybody. Thanks for watching.